Well, colon cancer is the second leading cause of cancer death in the United States. Each year, nearly 150,000 Americans are diagnosed with the disease, affecting men and women equally. Today, Dress in Blue Day for a future free of colon cancer. Joining me is Dr. Brian Mannion. He is the oncology physician with Cincinnati Hematology-Oncology, medical director of oncology services at the Christ Hospital. Dr. Janice Rafferty, professor of surgery, chief, division of colon and rectal surgery, UC Health, and Wayne Young, whose wife is battling colon cancer and a very dear friend of hers here at FOX19. Welcome to all of you.
Thank you.
Doctor, let me start with you first. What is colon cancer?
Well, colon cancer is a disease that affects any American. It affects people mostly over the age of 50, but not necessarily. It can sometimes present with sometimes no symptoms, sometimes blood, sometimes change in bowel habits, but it's something that we all need to be aware of.
Mm-hmm. And why is it about colon cancer? It seems like that it's maybe one of those cancers that is very difficult for people to talk about.
I think it's difficult to talk about because people aren't used to talking about those kind of things. And so I think the more awareness that we have for it, I think that is going to be very beneficial.
Dr. Rafferty, let's talk about the treatment. Once the diagnosis comes, early diagnosis, is colon cancer treatable?
Absolutely. Colorectal cancer is very treatable if it's found, especially before it becomes invasive or goes all the way through the wall. It's most treatable if it hasn't even become malignant yet. Colorectal cancer is one of those diseases that has a pre-malignant stage. It's called a polyp. And if polyps are found before they even turn into cancer and those polyps are removed, the risk of cancer from that polyp is gone. And then we can follow that patient long term for any polyps growing back. But you know, the unfortunate fact is that probably 65% of patients present to their doctor after their cancer, whether it's in the colon or the rectum, has already gone through the wall and gotten into the lymph nodes. And that decreases our ability as oncologists and surgical oncologists to cure the disease. Mm-hmm. So it becomes more difficult.
Mm-hmm. And unfortunately for you, Wayne, that's similar to your situation and with your wife. Caught early, so back in 2004 is when she was diagnosed.
Unfortunately not caught early. We really ignored the warning signs, and that's why this is so important to my wife and to I, that we let as many people know to pay attention to your body and pay attention to the warning signs. And what we just talked about off air is the fact that colon and rectal cancer is really the only type of cancer that is preventable if you pay attention to your body and catch it early enough. In the case of Maria, unfortunately, in 2004, we did not catch it quite early enough. It had already grown to a very large state and was affecting a number of parts of her body in that area. She did have surgery and was cancer-free for 5 years, but the really devastating thing, as Dr. Rafferty was just saying, is the cancer has now migrated to other parts of her body from the rectum and is dramatically affecting her health as a result of that.
Yeah, very sad for us here and to hear that story. And so, doctors, what's important is that people are getting screened at age 50. I mean, here are some things on your screen that people need to do to take prevention, right, of developing colon cancer.
That's right. So getting screened is different than going for an evaluation when you have a symptom. People should be screened if they have absolutely no symptoms and they've reached the age of 50, or 10 years earlier if they have a first-degree relative who's had a polyp or a cancer. Getting a diagnostic exam is what's done if you have bleeding or you have a change in bowel habits. And that's one of the things that, as you asked Dr. Mannion earlier, why don't people talk about this? Mm-hmm. People don't want to talk about their bowel habits.
Right.
It's not
uncomfortable.
Right, it's uncomfortable
mm-hmm.
to talk about. It's a very private part of everyone's life,
mm-hmm.
Your toileting habits. And it's something that you need to pay attention to and talk about if there's a change. That's the only way we're going to make significant progress with this disease.
And I think just in awareness, I think a perfect place to end is, Wayne, with your granddaughter donning blue today, you know, for her grandmother, I'm sure for the rest of your family and just for the rest of the country, right, to bring awareness and the bottom line, to talk about it.
That's right.
Right. Thank you so much for joining us.
Thank you for having me.
More on the Xtra in just a moment. We'll be right back.